Okay, this is Dr. Mcdougall on hypertension, part 4, and it's from this book, the John Mcdougall, the Doctor Who Fought for You, written by me, Pete Rogers. Okay, so we left off in the chapter right here where Dr. Mcdougall says, Walter Kempner taught me that diet therapy was the most powerful therapy that there is. Dr. Mcdougall had said, of course not including himself, the greatest doctor who ever lived was Walter Kempner. And that's why it's worth it to go to drmcdougall.com's website and read the Kempner book. It's extraordinary. Or read his biography by Barbara Newborg. You just have all these patients that are never, ever cured by drugs or surgery. Kempner, cure, 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 cure. Okay? Reversing EKG findings, shrinking congestive heart failure. It's like, Superman or something. It's extraordinary, the life story of Kempner. That's also why Dr. Mcdougall had said, don't even talk to me about all this nonsense paleo, keto, carnivore stuff to trick the pros into being chumps. Read about Kempner and Pritikin, all these incredible cures they had, and you'll see that diet therapy is the most powerful thing there is. I can tell you it is. I've been a doctor over 30 years. The most powerful thing I ever learned was that humans are meant to eat starch. And all doctors should know that, but they don't. A zookeeper knows what you feed an animal, but doctors don't know what to feed a human. And most of our diseases, the gateway diseases, obesity, diabetes, hypertension, atherosclerosis, they're all dietary diseases. Okay, so Kempner practiced before antihypertension drugs were available. Kempner severely restricted sodium, and he would get daily sodiums down to below 500 milligrams per day. So that's why Kempner talked about a threshold. He says you don't get much of a difference, sure, when you go from, let's say, 4,000 to 3,000 milligrams per day. But once you get down to 500 and less, you can get a big improvement in blood pressure from that. Mcdougall also made the point, as soon as you go plant-based, low-fat plant-based, you avoid all the fat. That dramatically lowers blood pressure, okay? Plus, you start eating the good stuff. You get the potassium, the magnesium, the nitrate precursors in the greens for making nitric oxide. Those are all going to open up arteries and improve blood pressure. So a lot of things simultaneously happen when you switch from a meat and processed food diet that's going to be high in fat, high in sodium, to a low-fat plant-based diet that's going to be high in all the good stuff. Antioxidants, nitrates, magnesium, potassium. Okay, Dr. Mcdougall says that the Mcdougall diet is effective for lowering blood pressure in hypertensive patients. Even after taking 90% of patients off their blood pressure medicines within 7 days, the average drop in blood pressure was 18/11 milligrams of mercury per day. So 18 milligrams systolic, 11 diastolic. So he said even though he took the patients all their antihypertensive medicines, they still dropped their blood pressure relative to their baseline. My low-fat vegan diet for treatment of hypertension does not allow nuts, seeds, or avocados. That's an important point because all these people are always asking me, what about nuts and seeds or avocados? I would recommend you avoid that. And I know a lot of people are going to tell you otherwise. Well, they can tell you whatever they want. The more fat you eat, the more you're going to clump your red blood cells together and be prone to hypertension. The more you're going to be prone to weight gain, to obesity, to hyperlipidemia. Why would you want that? Okay, a lot of these old people, you're sick, you're messed up. Why mess around with this nonsense? All this fat, increased AGEs, for what? You don't need it. Okay, blood pressure also improves as a person's body weight optimizes towards normal. And also, then you get into the Seventh-day Adventists, and there's going to be a lot of people tell you, well, the ones who ate nuts were healthier. That's actually debatable. Dr. Mcdougall had said there was industry funding affecting the conclusions on the nuts in the Seventh-day Adventist studies. Okay, anything funded by industry is always bogus. They wouldn't fund it. They wouldn't publish it unless it made them look good. So you can't rely on anything funded by industry in that sense. Okay, Dr. Mcdougall continues. Body weight improvement also improves blood pressure. To determine what your optimal body weight is, you can take your clothes off and look in the mirror. If you like what you see, your body weight is probably okay. You can also look at the recommended body weights of Dr. Walter Kempner. He actually recommended people be a lot skinnier than most of us are used to today. Okay, this information from Dr. Mcdougall came from his website, drmcdougall.com, and some of his videos, Best Diet for Hypertension, Shocking Truths About Blood Pressure, and Hypertension, Drugs, or Diet. Okay, got more information coming now. Okay, this is again from Dr. Mcdougall in his newsletter, July 2004. If you go to his website, drmcdougall.com, you can just type in July 2004 newsletter, or you can type hypertension into the search menu, Okay, here's what he says. If you overtreat your blood pressure, you could die sooner. Yes, I see lots of people who are overtreating their blood pressure. Stupid. They don't understand the point of hypertension treatment. The point is to not have excessive blood pressure, because if it's too high, you increase your development of atherosclerosis, a small increase in the risk of brain bleed. But if it's too low, then you drop the pressure to your brain and you run the risk of being hypotensive, passing out, having a stroke, or just being cognitively impaired. That's not good either. Gradually developing apoptosis, atrophy, the vascular hypothesis of dementia, Jack Della Torre theory. Okay, Dr. Mcdougall continues. The reason that too aggressive treatment of hypertension with medications causes serious harm is because the artificially lower blood pressure impairs blood flow to the heart and the brain. This can result in heart attack or stroke. Even before the point of heart attack, this can lead to arrhythmias of the heart, which can be fatal. Okay, chronic high blood pressure thickens the left ventricle, okay, and make it harder to perfuse it, less diastolic filling time, less diastolic recoil from your less of a Windkessel effect in your ascending thoracic aorta. Dr. Mcdougall continues, overtreated low blood pressure is associated with poor thinking and dizziness, I would add. Overtreatment of hypertension can lead to dementia. Okay, I'm going to put this, just words added by me. Okay, additional comments by Peter Rogers. I can tell you, every day I see a bunch of old people, and I can tell you the history. They all get CAT scans of their brains because they all fell and hit their head. And the most common reason they fall is because they're overtreating their hypertension. All right, so they're dizzy, they're lightheaded, they pass out. Okay, and it's the typical history is old guy fell, hit head, old guy fell, hit head, old guy BHT, blunt head trauma, old guy TBI, rule out TBI, traumatic brain injury, all day long, nonstop. Old guy fell, hit head on blood thinners. Okay, there are a few things more common than old guy fell, hit head on hypertension pills. Okay, and I told you, like my neurology friend, this lady, she ran a clinic for falls to help prevent patients from falling. And she said what it really was is a dementia clinic, The same patients that are falling, a lot of the ones that are becoming demented. The brain's more important for exercise than it is for thinking, for body movement and stuff. Okay, that's why exercise helps prevent dementia. And you don't want to overtreat hypertension. Okay, what else what my comments that I would add to this chapter? Processed foods are high in sodium. When you stop processed foods, you markedly lower your sodium intake. Low-fat plant foods have additional features that lower blood pressure. High in potassium, low in sodium. Richard Moore, MD, PhD, he's the guy who wrote High Blood Pressure Solution. It's the best blood pressure book ever written. It's magnificent. He wrote that it's helpful to have your K factor, meaning potassium to sodium ratio of at least 5-1. Our ancestors likely had K factors of over 20-1. Modern Westerners tend to have K factors the opposite, flip. They eat 10 times as much sodium as potassium. Stupid. Plant foods are also high in magnesium because magnesium is located in the center of chlorophyll. It's a vasodilator. Potassium, P for plants, P for potassium. Plants, greens especially, tend to be high in nitrates. Those are precursors to make systemic nitric oxide. Nitric oxide is a vasodilator, opens up artery, dilates blood vessels. When you go in the sun, you get some release of nitric oxide, subcutaneous precursors. That's why you feel good when you walk out in the sun. Dr. Mcdougall is not that big of a fan of magnesium supplements. I know some doctors, some really good internal medicine doctors, they like magnesium supplements. Mcdougall did not. Okay, he would say just eat your whole food plant supplement, your whole food plants. Okay. Plant foods also contain antioxidants, which are helpful to vascular health. Plant foods contain fibers, so it prevents leaky gut-related amyloid clotting. So it prevents postprandial endotoxemia, postprandial bacterial endotoxins getting into the blood. This helps prevent blood sludge, lowers blood viscosity, lowers blood pressure. Okay, the reference for what was previously just discussed here from Dr. Mcdougall was also April 2004 newsletter. Need potassium, take vegetables, not pills. So that's it for hypertension. I hope that was helpful.